And it's time for our conversation with our friends from the Veterans Providers Group. Let me, again, press some more buttons. We're in the button pressing mode today. Our conversation brought to you by Marcus & Mack, a law firm representing injured people. And Diann Overman, our Veterans Outreach Coordinator here in Indiana County, is on the line. And Diann, you have a guest with you today.
We do. Good morning, Todd. We have Katie with us from our Veterans Leadership Program. The VLP has been part of our group for many years. Very active, always a good resource for us to reach out for any need in our county. So she's going to talk a little bit about her role and what they do to help veterans and how they work with the Veteran Providers Group.
All right, Katie, good morning to you.
Good morning.
Tell me.
Hi, Katie.
Hi.
So tell me about this program we're talking about here, Katie.
So currently at VLP, I oversee the SSVF program, and that stands for Supportive Services for Veteran Families. And basically the program assists veterans and their families with locating and securing permanent housing. So those veterans could be facing homelessness, whether that's an eviction, we help keep them in their home, or if they are homeless, couch surfing, we assist them into getting into their forever home and setting them up with whatever they may need for that new home to ensure that, when we step out, that they are able to maintain that home on their own.
Now, Katie, you're involved in how many counties with your particular office?
So the VLP oversees, I believe it's 30 counties. The SSVF program oversees 27 of those 30 counties,
that's
including Indiana County.
That's a lot of coverage area, and so it takes pretty dedicated staff to do what you do. And I'm looking at the number of different services that you do. That's a really broad outreach, isn't it?
It really is, yes. We assist veterans and their families with a very large range of services at VLP. Not only do we do housing for veterans and their families, but we also assist them with employment if they are either unemployed or underemployed. They don't have enough to really make ends meet. We do help them do resumes and secure additional employment that will help boost their income.
You're based in Johnstown, yes?
What's that?
You're based in Johnstown? Is that where you are?
Yeah, my position is in Johnstown, yes, but we have staff all over the western side of Pennsylvania, so our staff do go out in the community and meet with veterans, and we're well connected in the different counties that we cover, so we make sure that they get and are connected to their own community that they live in.
Diann, bring that home here to Indiana County. How do you folks work with the Veterans Leadership Program? Is it just meetings at various locations, or how does that all work out?
Well, we have several people from VLP that come to our meeting, sometimes at different times, sometimes all the time. Now we're doing virtually, so it's more available for people to chime in on phone calls. But they attend every meeting that we have, and we do meet monthly, every third Wednesday of every month at 1 o'clock. Typically it's at the Career Link, but now we're doing it virtually. So when we have we're working with a veteran in our area, or they're even working with a veteran outside the area, it's so nice to be able to pull resources together with a group of people that provide, in terms of housing, medical, employment, education. It's nice to have one group of people. I can shoot an email out to the group, and within minutes, there are people saying, I can do this, I can do that, I can provide this, whatever. And VLP is instrumental in that.
There probably is not a program or some sort of organizational structure in place like there is for veterans. All groups seem to all want to work together. And Katie, I think it's interesting that the word bridge keeps coming up in relation to what the Veterans Leadership Program does. You really do serve as a bridge to get over some pretty serious gaps, don't you?
Definitely.
Yeah.
Yeah, that is really what's unique about this group. We've had a couple veterans this year that came into the system one way or another through word of mouth or through referral that were living in hotels or homeless. One was living in their car. We were able to get them hooked up with housing quickly. We have, of course, the community gardens, which is permanent housing here in the county. But we also have the Veterans Parsonage, which is homeless, and that's funded by themselves. So we're a lot more lenient on, there's no rules with the federal guidelines. But we also have the HUD-VASH vouchers here in the county. So we were able to, under HUD standards, that person that was living in a hotel necessarily wasn't homeless. So we were able to get them into the homeless shelter, the parsonage, and then we were able to get them on the list with no waiting list at all when it comes to HUD vouchers, which are vouchers, Section 8 vouchers, that are just for veterans. Mm-hmm. So it really does bridge those services. It's just unique the way it works, and we're very fortunate to have that support system here in the county.
Diann, you, Katie, as well, you can talk about this. Veterans, sometimes you have a problem working with them simply because they have been trained to be sufficient enough on their own that sometimes they might not recognize that there are services out there available to them and that they need to take advantage of those services because that's what it's all about. That's what it's there for. And to develop those programs, you really need veterans to participate and to step up and admit the need that they have, don't you?
We do, and that can be a challenge. Like you had said, it's hard for them to ask for help and be honest about maybe everything that they need. On the surface, it might be housing, but it could be employment. They need beds for their kids. They need food. So we're just kind. We're there for them. We make, when we talk to them, just as comfortable as an environment as possible. Some of the questions we ask are designed we practice motivational interviewing, so our questions are designed to kind of get to the root of everything that they might need and just make them feel comfortable enough to share with us, that they do need things outside of just rent for an apartment.
Do you work with agencies that might not necessarily be military in order to meet some of the needs of the veterans?
We do. We partner with many shelters that are not just veteran shelters, community actions that are rooted in the community and don't just serve veterans. So when a veteran does come to that agency and may need help, they know to reach out to us.
We're talking this morning with Katie Bozic and with Diann Overman about Veterans Issue. It's our Indiana County Veteran Providers Group visit. We do this once a month. Diann, this service that Katie's organization is able to offer, the Veterans Leadership Program, seems tailor-made for Indiana County. There are so many veterans here in Indiana County. So many of them have found their way in order to assimilate themselves back into general society, and yet there are needs that need to be met, and there are many people out there willing to help them meet them.
Yeah, there is. And, Todd, as Katie mentioned, they, network with a variety of agencies that are in their community, and that's also what comes to the table for the Veteran Providers Group. ICAP is always there. Mental health is always there from our county human services. Even aging services, because they have veterans in their organization. So they all have come to our meetings and provided information on how we can support veterans that we're working with that might have a need in their agency. And I think one thing that is very important is the number of veterans that we have that belong to the Veteran Providers Group. I think that's key because sometimes veterans do respond better to veterans. So we have several, including Al Walker, Kevin Laser, David Gray, Dr. Corey Shea from IUP. All of them come to the table and they're able to help us, assist veterans because sometimes they just need another veteran to talk to.
Yeah, absolutely.
That's key sometimes.
Yeah, and one of the interesting things to me as well is the fact that as we watch people age, and the World War II generation and the Korean War generation their health is failing. Those who are left among us and with us, and we salute their service and understand that now the the more elderly population among our veterans are people from the Vietnam War era, and they have their own different issues, and so you have to be adaptable to meet whatever those issues might be.
Absolutely, and that includes my father, who was a Vietnam veteran, and that leads me into talking about the Legacy Project and documenting those stories, because those stories aren't going to be here forever, and so we're working really hard with ICTC to give veterans an opportunity to share their experiences and stories and have them documented so that the family will have those forever. And that's in whatever way the veteran feels comfortable to share that story, because it's different and unique for each one.
I know that pandemic has sort of hurt you a little bit in what you would like to do. Is it back on its feet and maybe not running full steam, but at least moving forward now?
Yes, it is. And as I mentioned last month, we did complete our first one with a World War II veteran. We're hoping to share that with the public as soon as we're able to make contact with him. But we're still doing a lot of work. With the Legacy Project, we just finished up Trees for Troops, which was very successful. We were able to have a great day out at Matriciak's Tree Farm on December 5th. 130 trees were purchased. $364 was made at the concession stand, which then went back to purchasing trees. Those trees were sent to Hurlburt Field Air Force Base in Florida. So we find that successful with all the challenges of COVID. Mm-hmm. Wasn't quite the numbers that we've had in other years, but certainly was successful.
Absolutely. And
we'll be working on the sleep out, too. That'll be our next big.
Yeah, we had the Wreaths for Indiana County Veterans project as well.
Yes, on Saturday.
That was going well.
Yes, and please let everyone know that all these things that are happening are always on our Indiana County Veteran Providers Group Facebook page. Please join that page. It's not just events, but it's resources from the DoD, local resources for veterans, food distributions, anything that we think families can. Would need, we get that posted immediately on there. So tap into that resource. It's good information.
Katie Bozic, Veterans Leadership Program, Diann Overman, Indiana County's Veterans Outreach Coordinator. Thank you so much both for being with us today.
We thank you, and we wish you happy holidays, Merry Christmas, Happy New Year.
Thank you very much. Bye, Katie.
Bye, Katie. Thank you. Katie, thank you.